So the POUT is the first randomised study ever providing level 1 evidence of the benefit of adjuvant chemotherapy for patients with upper tract urothelial cancer who have undergone a radical nephron-ureterectomy. And POUT recruited patients with T2 to T4A disease who could be node positive as long as all nodes that were seen preoperatively were removed at the time of surgery, but we didn't mandate a formal lymph node dissection. And then patients are randomised to receive either 4 cycles of chemotherapy with gemcitabine or cisplatin, or gemcitabine or carboplatin, or surveillance. Now the important thing here with the type of chemotherapy is that the second drug with gemcitabine was given to all patients, but carboplatin or cisplatin was given based on GFR alone. So for patients GFR was above 50, they got cisplatin, and that's actually quite permissive for cisplatin, but is what we see in real life practice. If their GFR was between 30 and 49, then they had carboplatin, and the only reason to substitute carboplatin was for poor GFR, for poor renal function. So if you had a patient that was unfit, they weren't suitable for the study. And the study randomised patients to 4 cycles of treatment, and it was very important to start that treatment within 90 days of surgery or to surveillance. So what did we show? Well, the study was originally powered to look for a change in disease-free survival, which was quite ambitious. So we were looking at 3-year disease-free survival because that was an identified key point of interest, and looking for an improvement in survival with chemotherapy of 15%. What actually happened was that in November of 2017, the Independent Data Monitoring Committee met and said that the study had met its primary endpoint and had met it early at 2 years rather than 3. And so the study was at that point closed to recruitment. And at that point we'd recruited 261 patients. And this is from across the length and the breadth of the UK. There were 75 centres open and 57 of them recruited at least 1 patient. The findings of the study, well, this is a positive study. It's the first practice-changing study in this area. And in fact, it's the only randomised study of systemic therapy in upper tract urothelial carcinoma. There is a 17% difference between the 2 groups in terms of 2-year disease-free survival. So it's 54% of patients in the surveillance arm were disease-free at 2 years compared to 71% in the chemotherapy arm. We have the same results in all of the subgroups, remembering that these were pre-planned subgroups, so the patients benefited irrespective of whether they were node positive or node negative, and irrespective of chemotherapy type. So gemcitabine carboplatin was as effective as gemcitabine cisplatin, although fewer patients received the carboplatin group. Metastasis-free survival was also positive, again with a 16% difference between the 2 groups. The overall survival data is immature at the moment because the study had to shut prematurely because it was positive. So we are collecting data at the moment. If we look at the curves for overall survival, which we have done, and of course we can't apply formal statistics to it, there does seem to be a trend to an improvement in overall survival. The important thing with the chemotherapy study is that it is safe to give as well. And if we look at the age distribution of these patients, 80% of them were over 60, 60% were over the age of 70, and 5% over the age of 80. And 72% of patients received all 4 cycles of chemotherapy. The side effects that we see were exactly what you would expect with chemotherapy. It's a chemotherapy study. The rate of febrile neutropenia was between 5.7 and 7.8%, depending on the type of chemotherapy. But very importantly, there were no neutropenic deaths and no deaths on treatment during the study. There was 1 death a year after completion of study, and that was from an unrelated GI bleed. So we can say that this is a safe treatment, it's effective treatment, that it is practice changing, and we also have quality of life data to show that although there is a temporary dip in patients' quality of life on chemotherapy, just around the time of cycle 3, it does recover quite quickly, and at 12 and 24 months there's no difference in quality of life.